Medication can help you reclaim your mental health, but when it leads to physical changes like weight gain, it's important to find a balance that supports both aspects of your overall health. The doctor is in, let's begin. Okay, so for today's session, we're going to take a look at how medication for mental health can be both life-changing and challenging. Whether you're managing depression, anxiety, schizophrenia, or another form of psychosis, the right medication can make a huge difference. However, these meds can sometimes cause side effects that feel just as difficult as the conditions they treat. One of the most common side effects, and the one we'll be going over today, is weight gain. And as an overview, mental health meds work by rebalancing chemicals in the brain, which can make day-to-day life more manageable. But some of these meds can also cause weight gain over time, and I get it. What's the point of feeling mentally better at the cost of feeling physically worse? It's like trading one problem for another, and that's just a battle in of itself. And don't worry, not all meds have the same impact on your weight. Some barely make a dent, while others can cause the pounds to add up faster than you'd expect. This is why working closely with your doctor is super important to find that perfect balance. So, let's start with the meds that have a low risk of weight gain. These are your SSRIs, the selective serotonin reuptake inhibitors, which are commonly prescribed for both depression and anxiety. In particularly, it's drugs like Prozac, Roloft, and Lexapro that are generally considered to be the low-risk weight gain medication. And while you may experience a small increase of about 2 pounds over several months, it's typically not a major concern for most people. Even though a 2-pound weight gain doesn't sound like much, it can still be frustrating, especially if you're already dealing with mental health challenges. However, these medications can significantly improve mood and decrease anxiety at the same time, making the small weight gain worth it for many who choose to do so. Next up, let's talk about medications that have a moderate risk for weight gain. This is Celexa and Paxil. Those are also SSRIs, except they fall into the moderate risk category. Around 13% of people on Celexa gain a noticeable amount of weight after 9 months, about 2 to 4 pounds. And then there's Paxil in particular. That's known to cause more significant weight gain over time, around 8 pounds or more in the span of months to year. It's also one of the harder SSRIs to stop suddenly because of withdrawal symptoms like dizziness, insomnia, and even those uncomfortable brain zaps, which are electrical shock sensations. There are also antipsychotic medication like Rexulti and Vraylar, which are often prescribed for schizophrenia or bipolar disorder. And they help balance dopamine and serotonin, but can lead to moderate weight gain, especially with long-term use. Now, if weight gain is a major concern for you, it's important to be aware of the medication that come with a high risk for weight gain. Remeron is a big one. It's highly effective for treating insomnia and depression, but it can also lead to significant weight gain. Some people may gain up to 16 pounds over the course of 2 years, and that's a lot when you think about it. Then we have the heavy hitters like Seroquel and Zyprexa, which are prescribed for mood disorders and psychosis. These medications can cause major weight gain, up to 12 pounds or more a year. In addition, Seroquel can raise your cholesterol and blood sugar levels, which could lead to other long-term health issues. Even Abilify, which is sometimes seen as a less sedating option, can cause an 8-pound gain over the course of a year. So it's important to discuss these risks with your doctor to weigh the pros and cons. Pun totally intended right there. And here's the good news. Not all medication cause weight gain. Some are weight neutral, and a few might even help you lose weight. Wellbutrin is a well-known option that actually helps with weight loss. It works by focusing on norepinephrine and dopamine rather than serotonin, which can help improve mood and energy levels while potentially causing you to shed a few pounds. There's also Effexor. That's another great choice if you're looking to avoid weight gain. It's an SNRI, which is it's a serotonin norepinephrine reuptake inhibitor. And it's generally considered weight neutral, meaning you're unlikely to gain or lose weight while using it. And then there's its cousin, Pristec. It works similarly and has a minimal effect on weight. Finally, there's Trintellix. That's a serotonin modulator that not only avoids weight gain, but also boosts cognitive function, like memory and attention. So you get double the benefits. At the end of the day, medication can be life-saving in the short term, but the long-term focus should be on building healthier habits that don't rely solely on them. Therapy, support systems, exercise, and lifestyle changes are all essential for improving mental health without the side effects that often come with long-term medication use. Finding balance is key, so work closely with your doctor. Understand the potential side effects and don't hesitate to ask questions. And remember, and I cannot stress this enough, don't stop taking any medication without first consulting your doctor. With the right approach, many people can gradually reduce their dependence on antidepressants and other medication over time. It is possible to manage your mental health while also looking after your physical health. And with that said, let me know what you think. If you enjoyed listening and want to hear or see more content like this, like and subscribe, follow me on X. The doctor is out.